Dear colleagues, welcome to this press conference to have an overview on the situation in Quebec about COVID-19. The Premier of Quebec, Mr. Francois Legault, is together today with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier, thank you very much. Hello to everyone. So before going over the numbers of the day, I would like to come back to the respective guidelines. First of all, I'd like to repeat, as I often have, the vast majority of Quebecers are respecting the guidelines, and I'm very proud of Quebecers. The Quebecers impress me. But it remains that there are people right now who are not respecting the guidelines. There are people who are gathering of groups of people less than 2 meters away. There are businesses that do not offer essential services or products that continue functioning. And at some point, we have to put all the chances on our side to reduce the spread of the virus. So today I have sent and I am sending a message to the police officers of the Sûreté du Québec and as well as the police corps of the greater cities, such as the SPVM, to be less tolerant. I think that right now we can no longer accept that there are people where a vast majority are making great efforts and that these efforts be banished by the actions of a few who don't take it seriously. So, police officers will be handing out more fines, and I repeat, they vary between $1,000 and $6,000 per person. So I think that that is what the people who are not respecting the guidelines should have. So I'm asking the mayors of the greater cities as well to make sure that the police officers have those guidelines respected. This is serious. There are lives being endangered. And if we continue seeing gatherings and companies that are still open when they're not essential, there will be lives, there will be deaths. So it's very serious. And those deaths, we don't know. It could be your grandmother. It could be your brother. So please, let's show a bit more solidarity, more than ever before. Let's be less tolerant. There's already been denunciations. I think there were 7,000 yesterday to the police officers. Well, the people who see that the guidelines are not being respected, I think that's where we're at right now. Now, the numbers of the day, unfortunately, we have 3 new deaths. So we are now at 36. And I offer my sincerest condolences to the families and loved ones of those 3 new victims. We now have 5,518 cases, an increase of 907, 365 people being hospitalized. That is an increase of 58. And we now have 96 people in intensive care, an increase of 14. As you see, the number of cases is increasing. But if we compare ourselves, if we look at the death rates, because that is, at the end of the day, one of the things that is important, limiting the deaths. Of course, that one death is one too many. But when we look in percentage of the population, we have fewer deaths, much fewer deaths in Quebec than in the United States or any country in Europe. So it has to stay that way. But in order for it to stay that way, everybody has to follow the guidelines. Also, what I wish to tell you is that our health network is ready. I was telling you yesterday, we have beds, a lot of beds, unlike other states in the world. And also what is important, and we made a full exercise of this, you know, the ventilators that we keep talking about, we have enough in what the predictions are as far as the peak is concerned. And there's not a lot of people in the world who can say that we have enough ventilators. So that is a huge advantage. Now, as far as the individual protective equipment is concerned, the masks, the gloves, the gowns, we received a few orders. It's true that it's arriving bit by bit. We're still at about a week's worth of inventory, and it is continue arriving in the next few days. It's possible that establishments say, I don't have enough for 7 days. What we're trying to do is every day, it happens that we take equipment that are in one establishment that has more than 7 days worth and to send it in another establishment that has fewer than 7 days worth. So let's be prudent. I'm not saying that every establishment right now has 7 days worth, but in total in Quebec, we have enough for 7 days. I saw some news, and it's true that in certain countries things are, they're playing rough. We're not going to name them, but we are also playing along with the rules of the game, which means that sometimes we have to have cash, we have to have police officers, we have to have people following the entire transportation. But don't worry, we are doing everything that can be done so that the orders that we are ordering make it to our hospitals here in Quebec. My daily thanks. All the healthcare staff. And perhaps we haven't said it often, but I also want to say a word about the staff that is working with Dr. Arruda at Public Health. We have hundreds of scientists. And I think that this is a great advantage that we have in Quebec. We have scientists who every day emit recommendations to us, and I wish to really thank them because they work night and day. And of course, there's the staff that works with a sense of duty and with humanity with the ill, and I wish to thank them. But I think that we need more than just thanking people. We also need concrete actions. And this afternoon, the president of the board, Christian Dubé, and Danielle, the Minister of Health, are going to be announcing an improvement to the wages. We're talking a total, an amount that is going to be pretty significant, $297 million. That is going to improve the wages of those who are in direct contact with people who are ill. And as well, because I think that is where there was the most work to be done, the attendance in private residences and homes. It's been talked about a lot. They have a very low salary. We will be increasing it by $4 an hour. It's important that the workers of those homes in the private sector be paid. And I think that when we look at all of these improvements and these increases, I've never seen a group that deserves an increase in wages as much as these people. So that will be announced this afternoon with more details. And I will end with my 3 priorities. More than ever, don't go out unless it is absolutely necessary. Don't go out. I don't want us to empty the grocery stores, but if you can go less often to do the groceries, that's a good idea. And when you do go out, even when you go to the groceries, even when you go for a walk, always keep 2 meters and don't gather up in parks. And when you come back, you wash your hands correctly with soap. So I'm convinced that if everybody, and I repeat, absolutely everybody, if everybody respects the guidelines, we will save hundreds of lives in Quebec. And let's look at the statistics such as they are. I mean, I'm proud to see that in Quebec, we have fewer deaths per million people than in Europe, than in the United States. And that's how we want to keep it. Thank you, everyone. A few words in English.
Today's numbers shows us an important increase of cases, but our health network is ready to face it. The most important thing is to follow the public health directives. If someone still thought it wasn't serious, it's time to wake up. Non-essential businesses must close and gatherings must stop. If they don't, police will distribute fines and force people into isolation. It's a question of life or death. So everybody must continue to follow our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances, and when you come back home, wash your hands. It's quite simple. If everybody follow those rules, we'll save lives, and I'll thank you all.
Merci, Monsieur le Premier ministre. Maintenant, pour
Thank you, Mr. Premier. Now for the question period.
Bonjour, Monsieur Legault.
Hello, Mr. Legault. What is the next step? If people continue gathering up, if certain stores continue opening, prison, the army, what's the next step? Well, we have all the powers via public health, in fact, of handing out fines, confining people, ensuring that they remain in their homes. So, of course, I mean, the last thing that I want, the last thing that I wish is to be stricter, but we will have to be more firm and make sure that the guidelines be followed. This is serious, what's going on. It's not time to say, I don't believe in that. Yes, it is transmitted from one person to another pretty easily when you're facing somebody less than 2 meters away. So be careful. What you said yesterday about the housing for the elderly, your tone brought certain people to wonder whether you are in control of the situation in those places. There are doctors in CHSLDs that are even telling us that they are being asked to limit to the minimum and to a few rare exceptions the transfers towards hospitals because of the crisis to avoid useless suffering. Are we there at making those choices? Well, first, it's never good to transfer people, especially the elderly who like having their habits and who feel overwhelmed when they go to a new place. What we're trying to do, and I think that Danielle is sending a lot of guidelines about this, and you know, in private homes, for example, there's a lot of temporary staff. There used to be a lot that worked in more than one home. So now we're trying to get them to work only in one residence. And we believe that increasing the wages by $4 an hour, at least we hope, to convince people who are working part-time to work full-time. We're isolating the hot zones. It's also important to say that in every residence where there are cases, the residents and their families are informed. But even those residences where there are no cases, we have to act as if there were. No visits. We have to be careful. And that is what everybody has to do in Quebec. We have to act as if we had the virus and that each person that we meet had the virus. And it's even more important in the elderly homes and residences. And it will get developed more, to give care on the premises. In the present context, it is primordial. In CHSLDs, even at the level of private residences that have some staff, giving care on the premises when it is possible, as much as possible, in order to not transfer those people to hospitals. If it is required, of course, we will transfer those people to the hospital. But we have to give as much care as possible on the premises to avoid them being distraught.
Monsieur le Premier ministre, Madame McCann, Monsieur Arruda, on m'informe que
I've been informed that there is an educator in the emergency daycare in a school in Montreal who tested positive to COVID-19. What we've been told is that the daycare center remains open despite everything. Do you have any information on that? And can you tell us what the procedures are, because of course it worries people who are bringing their children there. Well, listen, I was not aware of this case in particular. If it just happened, it is the Montreal team who's dealing with it. Each situation is evaluated depending on when the person was ill, what the person did, what they came in contact with. So there will be an investigation on that case and measures will be taken. If they haven't yet closed the daycare center, it's because they're investigating and seeing to the situation. But it is clear that we're not going to place children in a risky situation. It is possible. I mean, we have to see. Did the educator catch it somewhere? Did that person catch it from a child who's there and didn't have symptoms? It's the investigation that will determine it, but things will have been taken in charge to investigate to see what is going to be done with the contacts in order to contain the situation. I'm probably going to have, I'm sure that I'm going to have more particular information, but right now I have no details. But I'm sure that the City of Montreal is dealing with it. And just to tell you, I think that we have 3 or 4% of daycare centers that are open in Quebec, so there's no reason to take a risk. If one may be infected, we'll close it down and open another one. I've been told, and I don't know if you heard Doug Ford yesterday saying that the situation in Ontario was almost as serious as that of Italy and Spain. Mr. Ford said that yesterday in a press conference. That the situation be very significant in Ontario, and that's what he said himself, the Premier of Ontario. Shouldn't we take measures to try to limit even more the traveling between Ontario and Quebec? Well, first, for the time being, the situations are comparable between Quebec and Ontario. They're not at all comparable to Italy. I can tell you that I read that with a lot of attention. But just 2 numbers. In Quebec, we have 4 deaths per million people. In Spain and in Italy, they're at 200 deaths per million inhabitants. We're not at all situation. What we have to make sure is that we don't get there. There's a lot of road to be traveled yet, and there are measures that we've taken. And as I was saying earlier on, our hospitals, unlike what happened in Italy, are ready. 6,000 beds are available. We have ventilators for everyone. We're not at all in the same situation as Italy. Now, could the wave eventually arrive? Well, we have to make sure to be ready for it.
Oui, bonjour à vous trois. Excusez, je cherchais ma question dans mon document. Les États-Unis, pardon.
The United States have started testing all professional physiotherapists, anybody who has to go to many CHSLDs in one day. There are employees here that go from one to another. We talked about it yesterday. The CDC has also revealed that there are asymptomatic employees who could be vectors. In the present context, do you maintain your guideline that allows those employees to return to work after 7 days? And wouldn't it be time to consider tests or even quick tests, the ones that you've already spoken about, Dr. Arruda? I'd like to say one word and then I'll hand over the mic to Dr. Arruda. But what we said, what we are deciding to do right now, because we realize that we have to make an additional effort, is to reorganize the work. When you say that there are occupational therapists and others that are going to many residences, we're going to try to concentrate the same staff in the same residence. And we're doing that right now. We are organizing the way people work to decrease the number of people that are in contact so that they only have contact with people in one given residence. The situation that you are evoking, where we ask people to come back to work after 7 days, people who have no symptoms, that was very infrequent. It's not frequent. We do that in exceptional circumstances where we could have a break in service, where we would have no service whatsoever for the elderly. And we put all the protective measures up, washing your hands, taking the temperature twice a day, using masks. So that is very, very important. And I want to repeat, It's an exceptional thing that we were forced to do under certain circumstances. Your question is good, but you also have to forget, or not forget, but understand that we use tests where we think it will have the most effect. We maintained it at the beginning for travelers because that is where we had problems. And I can tell you that we have test of positivity over test that is very high. That means that when you test people and you find 10% who are positive or 12 and it goes in increasing, it means that we're testing the right category. If we test people and the test of positivity is at 1%, it means you're testing a lot of people that didn't need to be tested. So there's we changed the order of the priority. We no longer test the travelers, the people who are contact cases, we no longer test. People who have symptoms for which we can delay the test because they stay at home, we won't test anymore. We are going to concentrate on those patients and people in the staff that present symptoms. So reevaluating. When we increase even more our capacity for tests, we may have, random tests within the community. And in Montreal, we'll have a different strategy from that in Gaspésie because it's not the same epidemiology. We are all aware of that. And, the quick test that we're talking about is not available tomorrow, But when we do have the capacity, we will be able to test, and we'll even have genomics studies on the viruses, the cases that we've had, to be able to understand in more detail how we do things. So I can tell you that we always have an optimal use of the test for the right people at the right time and time. That will fluctuate. And we have to take into account the capacity of testing that we have. And we can't say that the capacity of Quebec is bad. We were at the bottom and went up almost to 4th at the world level. And we still have to keep testing adequately within the capacity that we have. And when we have more testing capacity, we'll test and test and test. And at some point as well, certain categories that we were testing, we won't need to test anymore because we'll have done our diagnosis in that sector and our treatment is good for that sector, but we'll have to go and test in other sectors. What are the orders of material that you're waiting? What quantity, when? Well, listen, we're not going to give a detailed breakdown of the orders. There's many. Some are still in the discussion stages. Some are going through Ottawa. So there are many orders that are expected every day. And we continue working and trying to increase certain of those orders. And we're also working, as I said before, with Quebec businesses and companies that will potentially be able to manufacture a lot of material here in Quebec. Sometimes it's not quite the same material, but if we take, for example, the gowns, we will succeed in manufacturing what we need. Mr. Premier, you said it earlier on, it would seem that now we have enough ventilators to respond to the peak demand. But imagine that a lot of people are wondering, how many is that? And also, have we started considering guidelines, for example, clinical committees or doctors to know that if ever they have to make a choice of prioritization, who is going to be allowed the use of those ventilators as happened in other countries? Right now, and we'll talk eventually about our scenarios, but in our most pessimistic scenarios, we have enough ventilators. So there is no question of having to start choosing who will get a ventilator and who will not. There will be enough for everyone, even in our most pessimistic of scenarios. We're receiving a lot of messages from families that are in metropolitan areas, whether they be around Quebec or Montreal. Their parents are elderly people who are in perfect health in private residences, who are there for amongst, four walls, sometimes in very small apartments, studios, for weeks, and it plays, of course, on their spirits. It's not just a telephone service and a CHSLD that can fix that. Those families want to go get their parents in those private residences, wait for them at the door and bring them into their homes and take care of them during the time that the pandemic will last, rather than being stuck alone and until the end of the pandemic. So would we allow those people to go get their parents and bring them back to their homes? Well, listen, I think that we'll have to have a look at that. At the same time, we've, of course, given the orientations that we have to move around as little as possible between the different regions, and even certain regions have roadblocks. And that it is preferable to know not go into other people's homes. So when you're in a home, to not change homes. It has not gotten to my ears, but perhaps I would go more towards Dr. Ruda to see from an epidemiological point of view what he thinks about this. Well, it's delicate to answer with a general orientation because this is more a case-by-case scenario, in my opinion. It depends on the region from where the person leaves and from what region they go. If you're talking about a place that is not at all affected as such, that would have to be analyzed. I don't know if you understand what I mean, because people who are in closed zones, even within a city like Montreal, in a 3.5, there's a lot of them, and we know it's not easy. And if you will allow me, in Quebec, we have gone towards an approach that is very understanding. And I'm very proud of the solidarity that we're developing. There's all sorts of initiatives, calling people, etc. There are stories of, families that go but respect the 2 meters. The problem is, imagine somebody of a certain age who's in good health but who comes back in a family where there is circulation and the person is incubating the disease. Do you understand what I mean? I mean, we feel good, we're doing very well, we say, hey mom, we're going to go get you. I don't know if it's to go to Saguenay or the reverse, but let's say you're coming to Montreal with us and we'll keep you at home with us, but the person is incubating. Do you understand? I'm not comfortable with that. If it's somebody in Gaspésie who gets somebody who lives in Rivière-du-Loup, I don't feel quite as uncomfortable. The principle here is to protect our most vulnerable. The more isolated people are, even isolated from their families, it's not that the family wants to infect them, but maybe they don't know that they are simply without symptoms. And we're no longer in a story of traveling. The intensive circulation, let's say, around the Montreal agglomeration, that's why we say it's better not. The other element that I want to say is not for people who are in quarantine who came back from traveling, but when we allow you to go for a walk outside, it's not to go have meetings together on somebody's front porch or in a park, 2 or 3 meters and take a coffee that you used to take at Tim Hortons, but now you meet up somewhere else. If we start doing that, the measure is not going to work anymore, and we'll have to do what other countries did. You don't go out at all anymore. And there are even countries that have, welded doors. That's not where we're at, of course. But I think the call of the Premier is we don't want to penalize everybody because some people participate and do it well and then others don't. But if ever we have to get there, at some point, we'll have to consider it. So my message is this is a case-by-case analysis, but of course it's not a good idea to go get your parents who are in a group at risk and to bring them in a zone that is worse because you might not know that you're ill. And also, we have to try to find solutions to break that isolation. Yes, there's the phone. Might there be other technological means? We are studying that right now, and other means as well of stimulating while keeping the necessary distance. But, there's been certain initiatives in residences for seniors, outside when it's the temperature is nice, and now we're going towards spring, where you can have events, and now we're looking at that right now. Because, yes, we have to break as much as possible that isolation. So we're very, very aware of the situation that is being experienced. And we also want to add staff, as we said yesterday. And I also want to add, beyond the precautions that have to be taken, I want to tell you that I am very sensitive to that. Saying that if a person says, I want to go get my mom, I want to go get my dad and bring them at home, well, the precautions have to be taken, but I am sensitive to that. I can totally understand that there are Quebecers who wish to do that. So we're not closing down the door eventually to that possibility. It's a case by case, but I can totally understand that there are people who want to go get their mother or their father and bring them home. I get it.
Merci. Prochaine question, Fanny Lévesque, La Presse.
Oui, bonjour. Sur la question du matériel.
On the question of the medical material, I heard my colleague's question. You don't want to go into the detail of what is expected, but could we at least have an idea of the needs, the estimates What do we need? What are the numbers in terms of quantities that we need for medical material versus what is predicted, what's planned? Can we have an idea? And also to have an idea of what's coming from Ottawa. Okay, well, just to give you an idea of the size and the scope of things, we're using hundreds of thousands of masks per day. So somebody who calls me and says, I have 100 masks or I have 200 masks, that's nice. But using hundreds of thousands of masks per day. So the orders that we're looking for are orders of millions, and we're working on that. And I am optimistic on that. The gloves. Well, we use millions of gloves every day. So they have to be orders of like tens of millions of gloves. So that is the scope of things. So we have good agreements, with perhaps not with the same fabric, but I'm confident for the gowns, say, that we'll be able to manufacture them pretty quickly. So it's mainly masks, the two kinds of masks, the N95 mask and the procedural masks for surgeries. But all I want to say is it's hundreds of millions of masks, so we're looking for orders in the millions. This morning we were talking about an order that had gone through, I don't know where, on the South Shore to go to Ohio. They were talking about 10,000 masks. I get it. We're not going to refuse anything. But 10,000 masks, compared to our daily consumption, is a pretty small quantity. So tell yourself that we have an excellent procurement department. I am following that personally, and we have business people who are giving us a hand. We have people with excellent contacts in China, for example, who are helping us out a lot. So we're doing everything that can be done in order to have enough. So we should understand that there are orders that have been placed in millions in equipment. Yes. Okay, very good. You also talked about Quebec companies that mainly raise their hands saying, I could do this, I could do that. Are there agreements, agreements that have been agreed to concretely, especially masks? Are there local producers? And could we expect, when could we expect that they arrive? Well, that's the question. There's a difficult period now. We have material for a week's worth. We hope to be able to. It's been 2 days that we've been receiving small orders that make it that we stay at a week's worth. And getting the material that will be manufactured in Quebec, that's more 3, 4, 5 weeks, depending on the equipment. So there is a period that's riskier, that's critical between the two. There's the question of production of masks in Quebec as well? Yes. I'd like to know what the situation is in youth centers, the DPG. What information do you have on that? Well, I often talk with Lionel Carman. I can tell you that today there are more employees in youth centers than there were at the beginning of the crisis 2 or 3 weeks ago. So we are adding staff. We have left aside certain services which were not quite as essential to bring more people into the youth centers. But for me, it's a great worry that I have to make sure that, every time that there's a call to follow quickly to be able to protect our youth and also protect the people who work in the different centers. Lionel Carman says that it is under control right now. I've also been told that the visits in palliative care units are forbidden as of yesterday. Why? Can you tell me why? I don't think so. Generally speaking, it's a case by case. It's a question of humanity. Yes, there is a risk, an important risk. But seeing one's mother or father for the last time before they die, I'm very sensitive to that. So I don't think that we will purposely refuse people, with masks and all the necessary procedures, that a person be able to go see somebody for the last time, a family member, before they die. If I may also ask a question, Mr. Premier, you said yesterday that Quebec was winning the fight against the United States for procurement. I understand that today you're also saying the stock was sent to Ohio. We're talking only about 10,000 masks, but it's not reassuring to see that we are going through the same thing as certain other administrations in Europe. What are you doing to make sure that our orders don't get hijacked? Could you ask, for example, Justin Trudeau to intervene with the U.S. administration to make sure that this does not happen? We're working together with the federal government, with Chrystia Freeland, with the embassies of Canada and other countries to take every necessary measure. And when we look at the U.S. states, there are states right now that would like to be in our position and to have material for a week's worth and to have enough ventilators for the peak. I find that when I compare myself to certain U.S. states, I find that we are in a pretty good position for the material and ventilators. Mr. Premier, if you'll allow me, I would like to give you an example. The situation as far as the N95 masks is concerned has improved somewhat. I want to come back to that because we've had questions yesterday and the day before on surgeries, treatments in oncology as well. So what I would like to say today is that we had three elements that have to be taken into account in those circumstances, that we have to have the capacity to have enough beds to really be able to render the services in a pandemic setting. And that's done. We have almost 7,000 beds that have been freed up right now. And there's also the question that we're pretty tight on the N95 masks, and now it has somewhat improved. There was also the blood bank that was pretty low. But now, Quebecers have answered our call, and our blood bank is in a much better position. So what I wish to say today is when we have elective surgeries, yes, we have to free those up to give the capacity for intensive care and the beds. When we have situations that can wait, well, we wait. But there are urgent situations for surgery and cancer treatments that we absolutely continue. But sometimes there's, things that fall between the two where you need a clinical judgment to see whether going forward with the treatment is all right, even if there is a risk for the transmission of COVID-19. But there's also the consideration of, do we have what we need? And what I want to say today is that the situation has improved somewhat, and we will probably be able to open up a little bit on those situations that are in between the two, where there's a clinical judgment that should be rendered. Should we go forward with this surgery? Should we go forward with certain kinds of cancers as well? And I believe that we'll be opening that up in the next few days because the situation has improved. About the concern that the elderly are experiencing, I know that you share in it, of course, but why not publish the list of the 519 residences for seniors where there are cases of infection? Yesterday, for example, how many of them are CHSLDs? How many are residences? Can Quebecers, do they have the right to know whether their parents are in a place that is infected? The information is also pertinent for the residents themselves. I'm going to let Dr. Arruda complete because I asked the same question this morning. What I've understood is that, first of all, the residents are always informed when there are cases. That's the first thing. Secondly, I would like for us to act as if every single resident were infected, that is, no risks to be taken. I don't want to send out the message to those that don't have any cases right now to say, oh, well, you guys are okay, you can take more risks. No, that is what's critical. The residences for seniors. And when we say that there's 500 and some that are infected, in some cases it's confirmed cases, and in others it's probable cases. So basically, some have one case, some cases have outbreaks. Every case is different. And we do inform the people who are concerned of the situation. And within the respect of confidentiality, we make information public when it is of public interest for the purpose of intervention. It is clear that any owner, when there was a case in their building, have to warn the rest of the clientele without disclosing the name of the person or the apartment. Ideally, they have to contact the family so that people are aware. What there could be, as far as public data, is the number per category, how many are in CHSLDs, etc. But having a list, that may be a situation in one case, and to have also a list to go investigate the details is not necessarily of public interest. But I have to say, and it's like that in the public service, people know when there's a case. And even, I would tell you, somebody who's in a residence apartment building, an owner that knows could put up a sign saying, without identifying whom, there is a case of coronavirus here. But when, as the Premier says, we have to act as if there was presence of this virus everywhere. That is how we'll be able to do what we have to do. Wash your hands, ask the people in buildings, to do what has to be done, like washing the elevators and the buttons in the elevators. And if you don't trust that it's being done, you can press the button in the elevator with your elbow or wash your hands right after. I mean, don't give in to paranoia or psychosis, but do what you have to do. So what says that there isn't a case here that isn't incubating and that won't end up in our statistics in 3 or 4 days? So that's how we have to act. If you are able to apply that to the maximum, to the utmost, if the recalcitrants who are not applying it yet start applying it, we will win the fight.
Oui, bonjour à vous trois. J'aimerais revenir sur l'approvisionnement.
I'd like to get back to the procurement of material. I would like to know whether money is an obstacle for the government of Quebec. Are we assisting here to a kind of bid? Earlier on, Mr. Legault, you said we also have to play the game. We pay in cash. We need the presence of police officers. Who are you fighting against? Well, against all the other countries that want to get some. And like often, it can be somebody who represents another country, but who's a middleman. Sometimes there are 2 or 3 intermediaries before you get to the state in question. So, yes, if you have to pay cash, you pay cash. And yes, the prices have increased, but for me, that has no value. For me, the life of Quebecers, we are ready to pay the price that is being asked for. There's no dollar amount to it. So when I say we're playing the game, well, if they want to pay cash, we'll pay them cash if it's necessary. You recently made a call out to businesses and even in education so that they send you the medical equipment that they have that could help you in case of shortage, and you said that help was welcome. First, have private companies been generous, and why not just requisition them with a government decree that all equipment that are, not being used in businesses and others be sent to you? Well, first, it's already pretty much been done. As I was saying earlier on, if we say that we're using hundreds of thousands of masks, if somebody comes and brings us 2 masks or even 100 masks, we have to be careful. We still have to stay efficient. We listen to everyone, and you cannot imagine for the past few days the number of emails, tens of hundreds of thousands of emails that I personally get from people who want to offer us masks. I'll give you one example. This was interesting. The president of Air Transat, whom I know well, I don't know why, but anyway, they stopped their flights the day before yesterday. They had 25,000 masks. That's not bad. So I, did what had to be done so that those be sent to us, and he had gloves and all that. And I do that, I'm telling you, I'm not counting the number of people, and I appreciate that. But we're looking for millions of masks. So, thank you. This completes for the questions in French.
In English, we'll start today with Kat Sonnet from CBC.
Good afternoon. Premier Legault, you said first that police officers were there to inform the population. You didn't want to create social tensions and you didn't want the army to intervene. But now the tone has changed.
Yeah.
What forced you today to say to police officers, please be more severe, more strict?
First, I receive more and more messages from the population saying, hey, you're asking me a lot. I respect your directives, but some don't. So what will you do something? So I think it becomes important that the police, that they give fines, and it's important fines. We talk between $1,000 to $6,000, and I think we're at this step now. We need to be sure that everybody collaborate, everybody respect the directives. I think it's important, and it's important also for the spirit of all the population. We have to work, all of us, together. And if few people are wrong, we have to see some consequences.
Second question.
Mrs. McCann, you talked about CHSLD's workers or orderlies that, well, for example, we have a case in the Mauricie that CHSLD's employees were called back before their 14-day isolation was up because there weren't enough workers. So then you talked about the 7 days, that they could be back after 7 days when it was necessary. But how solid are you knowing that it's possible when you are asymptomatic to pass on the virus? Isn't it risky for you to know that they are back after 7 days and they're working with seniors, vulnerable people?
Well, it's first of all, it's orientations from the public health, the Institute of Public Health, that has examined all the questions. We didn't decide that, without this advice, this scientific advice based on data, and we're taking all the precautions. I mean, the temperature is taken twice a day. The person is wearing a mask, and they're washing their hands constantly. So we're taking all the precaution, but this is, it's very exceptional, as I said, but between leaving people all by themselves without services, we cannot do that. We have to take the path that is the less risky for the person, and at this point, it's working out. But, we don't know what is going to happen tomorrow in this situation, but we have taken all the precaution. And as I said, all those measures are taken every day with the staff that are coming back after 7 days.
Samuel Pouliot, CTV News.
Good afternoon. Mrs. McCann, we now have seen an outbreak of at the Verdun Hospital. Is that symptomatic of the lack of protective equipment for healthcare workers there at the Verdun Hospital?
Well, I think we have to see what the Public Health Department says about the investigation at Verdun Hospital, but I think now it's under control. All the measures have been taken, and I know very well Verdun Hospital because I was a manager. I was the Director General there, and I know the staff and I know the Director General, and I've spoken with her recently, and the situation is under control, and all the precautions have been taken, the isolation, and that's what is important.
Okay. Good question. And we are getting calls, and we've done interviews with different companies and doctors who have developed ventilators or masks or even online triage tools. They are not getting any response from the government. Is there a problem? How the government is handling that?
We have a team of about 200 people working on that. Of course, they're going further in their investigation depending of the seriousness of those people. Sometimes I give you an example. People, they say, I'm ready to make some mask, but I don't have any material, I don't have any design, I have nothing, I only have people that are ready to work. It's nice from these people to offer their help, but we're trying to be closer to have people that will be able to deliver the material in the next few weeks.
Thank you. Yes. Yeah. Yes. So, question sent by email now from Phil Autier, Montreal Gazette, for Premier Legault. What measures is Quebec taking to ensure protective masks are making it from a supplier to Quebec? Are you sending planes? Are there police on these planes?
We use police force. We use also the relationship we have in different countries. So we do all what is necessary to be done to make sure that the equipment is going to the hospital.
And now for Mr. Arruda, we are seeing thousands of people waiting for test results. Are the numbers of cases and deaths you're reporting today an accurate reflection of how widespread the coronavirus is?
Yes, I would say for deaths it's clear. For cases, there was a backlog, but now that it's getting out. So and then we're going to be able to give, I would say, the right data. And in fact, there was probably cases that was announced yesterday that was supposed to be announced before if they get tested at that time. But we are correcting that. And so I think that if there is a people who dies from coronavirus, even with our case definition where sometimes we don't need to have a test, it's clear that the deaths and hospitalizations are the right ones.
And now a question from Raquel Fletcher, Global News. Are you concerned about getting the medical supplies we need given the worsening situation in the United States and the growing need in that country?
Okay, I think that all countries right now are worried about getting all the material. I think we are in a better position than many states in the United States. We still have for 7 days, and we have enough ventilators to go through the peak. So we are in a, it's not an ideal situation, but it's a best situation than many other states.
One very last question. The mayor of Oka says too many people are driving through his community in Saint Placid to access the smoke and marijuana shops in Kanesatake. He's asking for road checks to be put in place. Is it a concern for you? Should these shops be closed too?
Yeah, they must be closed, and I thought they were closed, so I'll check that.
All right, so that's all the time we have. C'est tout le temps que nous avons. Merci beaucoup tout le monde.
Thank you, everyone. See you tomorrow.